Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm really glad that you're here. And we have a really amazing guest today, a special guest, Sean Lacoursiere, who completed his PhD in cellular molecular neuroscience, focusing on the pathology of Alzheimer's disease. Currently, he works as Chief Innovation Officer of Maia Farms, developing mushroom-based food ingredients to nourish the brain, body, and planets. His ultimate vision is to use these food ingredients to help prevent dementia. Sean, thanks so much for being on the podcast.
Yeah, thanks for having me. Excited to be here.
We were having some discussions earlier. It's like, where's the connection with dentistry and dementia and food and overall wellness? And there's this very broad category that I think is going on in dentistry right now that I believe every dentist should lean into, which is the oral health as a gateway to overall health. And the connections between oral health and overall health are getting shockingly more connected every day. Frankly, a year ago, I was told some of these connections and I was like, yeah, there's some correlation, but not causation. But even now, when we talk about Alzheimer's disease, we're seeing periodontal disease bacteria in the brains of Alzheimer's patients. So that's a long setup to welcome you to the podcast and just say, I'm really excited to talk about, because I think of you as like an emerging technologist when it comes to overall wellness. Is that fair to say?
I think so. I like to try to strive for that. And especially again, like with what we're developing at Maia Farms is, yes, we have individual ingredients and products that we're trying to integrate into the food system, add a new ingredient technology, but fundamentally, we're trying to build a system of food production that is kind of a next generation system that, it again, integrates into things and tries to solve problems in both brain, body, and planet. So again, I think it's a bit of a different approach, a bit more maybe holistic in what we're trying to do. But again, it always comes down to how do we nourish life and increase the health and wellness of everyone around us and to everyone who eats our food. So
that's great. If you think about it, we as dentists, I believe we have to get involved with people's overall health, not just because it's going to be great for patients, because let's face it, physicians are not going to pay more attention to oral health other than they don't want to have to worry about it when they're doing procedures on a patient, medical procedures for a patient. However, our patients are going to be looking to us to guide things like, I believe, nutrition, which is why in my new book, Unfair Care, I talk all about overall health, how our healthcare system isn't broken. It's actually positioned for profitability, not for wellness for our patients. And the irony, I believe, is that if we focus our practices on overall wellness, it's going to increase our profitability. So when we're talking, and you've been in the dental space a little bit, so how would you, when you're speaking to dentists, and if there's a dentist that's thinking this, I've been thinking about getting involved with focusing on overall wellness for patients, where do you think they should begin?
yeah, I mean, that's a good question. I think it's just start with the patient themselves, right? People come into the dentist, they have all the bias around what it is. Maybe this is the first time they're coming to the dentist, they're really trying to get into a healthy dental routine. And so just again, like starting with the patient, yes, you're working on their mouth, but I think easy ways to just incorporate different diet recommendations, different supplements that they could potentially be taking. Again, like even things like exercise or in the mouth and the face, there's things like sleep and sleep apnea that you can maybe start to discuss with them. Hey, have you been snoring? And start to guide them in directions that maybe they're just not aware of. And because I think, again, like dentists sit at a very interesting point in where we are, right? Like it's very difficult to go and meet up with a doctor. You may have to sit in the emergency room for hours in some cases just to ask the question in some regards. But if you have a good cadence with your dentist, like you're maybe going there twice a year, getting regular cleanings. And this is just a cadence in which you can get a checkup. You can get this advice. You can have these conversations that you might not be able to get with a specialist doctor. And again, I think it's these continuous checkpoints that, prevention is the best medicine in this case. And because you're right there, you have these more prolonged periods of interactions, even with the patient. I think you can start to understand like where they are, where they want to be going with their health overall. And even then, I know many people who are frightened by the dentist. You got the poking and the prodding sometimes, but setting it up, not so much, hey, you're going to go in here and just get your teeth cleaned, but hey, you're going into this office space, this facility, and it's now approaching it more as an overall health and wellness facility that also does clean your teeth and provides a very valuable service. Again, I think this can help people change their perspective on what it is to be a dentist and what it is to interact with a dentist and have a dentist that you can talk to about these problems. Because like most chronic illnesses, they have a chronic path of development to get there. So specifically like Alzheimer's disease, it starts potentially when you're like the initial pathology around 30 in some cases, and then it'll take another 30 years before you even start to see any signs of problems. And I feel like tooth health has a similar kind of problem where you don't really see inflammation of the gum immediately, but you leave it for long enough periods of time, and now you have a big problem.
Periodontal inflammation seems becoming a very big link to a lot of systemic issues, right?
Yeah.
Including dementia and Alzheimer's. I think totally agree with everything you said. And it's interesting that we are also in this position as dentists where we talk about nutrition already, right? Because if somebody is drinking a lot of soda, if they're having a lot of sugar in their diet, we talk how it affects their dentition. But we don't talk about their overall wellness when it comes to so it's a very small jump to make. And in fact, it's almost putting blinders on just talking about the things that are damaging to your teeth versus about your overall health. And I know that now there's the term oral physician is being thrown around, which I think that, looking at yourself as an oral physician is good. And I think the reality is that medicine is very different than dentistry for a lot of different ways, right? And actually in Unfair Care, I talk about what dentistry gets right and wrong and what medicine gets right and wrong. And one of the things that I think dentistry gets not right, but better than medicine is prevention, as you talked about. It's going to be a much bigger leap, and I'm paraphrasing, so correct me if I'm off track. It's a bigger leap for physicians and for medical providers to talk about nutrition than it is for dental offices. And so if we see ourselves as oral health, as the gateway to overall health, which biologically it is, let's be real, not only systemically through things like inflammation and periodontal disease we're talking about, but also it's one of the only interior cavity. It's the easiest part of our body that we can visualize. So it's the sentinel so we can see systemic disease. And I would think that nutrition is part of that too. And so let's narrow it down even a little further and I have no insight into this before this conversation. If you're a dentist and you're talking about sugar and dietary habits and you're thinking this makes sense, like why don't we talk about actually nutrition in a way that is helping people with their overall health? How would you, because this is your area of expertise too, or one of you have a lot of areas of expertise, but this is one of those areas. What advice would you have for dentists to talk with patients about nutrition specifically?
Yeah, that's a really good question. Again, I liked it if you just go in and you go, hey, you have cavities, stop drinking soda. It's, hey, that's like, where are you coming from kind of thing. But if you can, again, like I said, guide them in the pathway to, hey, we noticed that maybe your teeth are a little softer and we noticed some cavities. Hey, sugar and these other types of dietary factors can influence this. And then going from the jump to now holistic health, like we can start talking about the oral microbiome and how dietary patterns can start to change the expression patterns and kind of the development of the oral biome as well. And like this can now lead to the conversation of, let's talk about overall health. And I think when we start to understand it more of, here's foods that can be bad for your teeth and they're unhealthy. Here's some foods that can be good for your teeth and help potentially regenerate, again, the microbiome. But then you can go, look, your teeth are part of your biological organism. So if your organism is more healthy, your teeth should be healthier. And again, it's now just, here's not just so much of the flossing and the brushing that can improve your health, especially like your oral health, but here's all the other behavioral patterns that you can incorporate into your life that can also lead to better oral health. So yes, stop drinking sugary drinks, smoking, these all are other factors that can really contribute. And I'm sure there's even some things, even with like how people are interacting with their home dental instruments, that may not actually be beneficial, but they just don't understand. Like learning how to floss a little better could be one of those factors where it's like, hey, you just improved this one little skill. Now your oral biome is improved. And I think, again, approaching it not so much as here's just the dentistry stuff that you can do, but here's all the other little things that if you can incorporate into your day, not only is your teeth health, your oral microbiome health improving, but again, overall health can be drastically improved as well. And again, you can always just start the conversation from tooth, mouth, and then up into overall holistic health. And again, it's like you said, the oral cavity is the one that's the most available to us in a lot of ways to assess like tooth health, inflammation, And I'm sure there's an array of other factors that you can tell by just looking into the mouth. And it's, hey, the mouth goes into the stomach and then the stomach controls the rest of us in so many ways. Yeah, good question.
I've been thinking a lot about this because I'm working with a company that's in stealth mode right now. That's going to be coming out, focusing very heavily on bringing overall health and wellness into dental practices. Because I think we understand that this is where we're headed. The people that listen to this podcast, definitely, but it's not well prescripted. And if you think about it, what you said, if you only tell people not to drink soda, but in reality, that's what's happening today in dental practice. Oh, you have a bunch of cavities. I bet you drink a lot of soda. Of course, I can see that. But we don't give alternatives and describe things. And this is where I'm going to get off over my skis. So I'm going to make statements that may or may not be true, right? If we said things like, your body craves what you eat, right? So if you eat sugar, you're going to crave sugar. Now, it's going to be a difficult transition to go from eating sugar every day to eating leafy greens, right? But what will happen is in the course of X days, months, I don't know what it is, your body's actually going to crave those leafy greens versus sugar. And by the way, you'll feel better and then maybe build on that by giving them tools. Now I'm thinking of where we could go with our patient application on tracking their diet so that they can actually change what their biology is telling them to eat based on their history. Would that be a reasonable course of action, or is that stinking thinking?
Right. So what you're saying is you provide them with these pathways to move to a healthier option and notify the patient. Initially, it's going to be a little weird. You make this switch, you're not going to really want it because your body's craving this one thing. But once you get off the train and start progressing towards more dark leafy greens, your body's now going to stop craving the sugar and start craving the vegetables. Is that what you're...
Yeah, I believe that to be true, but I don't know that.
Yeah. Again, I think people don't really realize how comfortable we become with our set point. Because set point is a mechanism that gets set in our brain that just says, hey, we're going to be at this weight. We're going to crave this amount of food. It does is help guides you to where you're going to be. And it sets that homeostasis of your system, but very adaptable. So if you start eating sugar, your body goes, this is the normal. Everything about our physiology, how we're managing glucose in our body, the insulin responses that we're going to have, they're just, yeah, this is what it feels like to be me on a normal day. But then you take away that problem, right? And all of a sudden there's something missing from me, but this is just normal now. You have to reset where you are and understand that the normal is now different. Once you make that change and then add sugar back, they go, whoa, this is weird now. You have to relate it back to oral health and dentistry. It's like, if you have like pain in your tooth and you start to ignore it, that's your daily life every day. You're dealing with this pain, but then you get it fixed and you're like, whoa, like you notice the difference. You notice that the pain is no longer there. And this is now your new normal. And it's much better. Like we can put the painful tooth back in, like in theory, and you're going to have now a terrible time because you went from this life that you're living down to what is like a better, less pain. And then it's like, you don't want to go back up. And I think pain is an easier way to visualize this maybe than just lower energy, right? Or like brain fatigue, because these are really like subjective. You sleep a little worse and you all of a sudden I have brain. But with diet, because it's a consistent thing that's always happening, it's sometimes difficult to go, this is my normal and it's not actually good for me. So again, I think what you're saying is that you have to help them get over that hump of what is normal and switch to a different set point that I think will allow them to then progress much better into the future as a healthier individual overall.
100%. I love the way you equated it to dental pain and patients not knowing that, because every dentist has had patients come in and tell them how they didn't realize how much pain they were in until they got their teeth fixed. So that's a perfect analogy, I think. Now, I want to talk a little bit about Maia Farms, mainly for me, because this is one of the benefits of being a podcast host. You can talk about me, right? Because I love crunchy, salty stuff, right? That's my thing. My wife loves chocolate and sweets, could care less. I love crunchy stuff. And you were nice enough to send me some of Farms products, right? That was my first thought. I could easily replace my crunchy stuff with this. So could you talk a little bit about Maia, just because I know that it's such a unique product. Maybe it's going to be something that dentists want to talk to their patients directly about, but it's such a unique product that I think it bears talking about on the podcast too.
Okay. Yeah. So I'll give a bit of a history of Maia Farms as a whole, and then what this product ultimately is. So Maia came out of what was called the Deep Space Food Challenge that the Canadian Space Agency and NASA had put together. I believe it was about a 3-year project in which universities, private industries, and just whoever really wanted to participate. The goal was how to feed things 4 astronauts for a trip to Mars, basically. So if you have to send them, you can't be necessarily like sending like a cow to space or a whole thing. The guys who ultimately became the co-founders of Maia, so myself and the other two co-founders, we worked with another group of engineers and scientists, and we ultimately built this like big system for kind of the future of food and future of decentralized and food for space. Ended up winning the competition. Maia Farms kept going on, and we were really focusing on what's called mycelium protein, which is a quick overview of a mushroom. So you have the fruiting body, which is typically the meat kind of you get at the grocery store. It's got the gills, it's got the stem, your typical white button mushroom. And then the mycelium is the root structure that grows underneath. So the root structure is like 90 to 95% of the organism, and the fruiting body is a very small portion. We are really interested in like, how can we grow this mycelium? It's super efficient, super high in protein, all these vitamins and minerals, and actually get it into a food ingredient. And so the product I sent you, as just a little aside here, is we initially built that product to solve an issue that one of our customers were having. And it was like, we really want the mycelium protein, but I just can't get enough of it. And so we tried to grow a bunch of mycelium, really couldn't do it. It's just we had too small of a lab. And what we could do though is we could take our mushroom product and extrude it with a pea protein. And so extrusion, you just take the proteins, you heat them up, you add some water, and you pressurize them, and you shoot them out a tube like you would making cereals and spaghetti, any type of dry material like that. And ultimately what we came about was what we call forms now. And so forms is an extruded product that's made of the fruiting body of the mushroom and the pea protein. And when you combine them, you get this really nice, like textured product. It's got a really nice flavor profile. Because you're adding mushrooms, you're getting a lot of these really interesting bioactive molecules like polysaccharides that are really good carbohydrates, really good fibers in the material. So we just kept developing this forms material, and now we have several different shapes and sizes. And really, again, it's designed for a meat replacement, but we're really just trying to get away from that as well. Don't compare this to steak. Don't compare it to chicken. It's just like a different protein, right? And it's a protein that's super high in fiber, very high in iron, but it doesn't come with the cholesterol. It doesn't come with the kind of baggage that the meat industry comes with. And yeah, really, again, this was designed for, are always thinking of like astronauts in space. It's sending it off to maybe a remote location where food is not really readily available, but people still need high quality proteins and fibers and things like that. So really, this was the development of this product. And now I think, yeah, we have 4 or 5 different forms of our forms product to hit all the different needs. So again, you got the little ground bits, you have more of the larger strips. So I don't know. I know you tried a couple of them, but did you find like any difference or favorites between the different forms, or was it just, it's all good?
I thought they were all fairly similar, so I wouldn't really say I had a favorite. The smaller ones I didn't like as much as the bigger ones, I would say. I like the bigger forms just because it's, like I said, I was thinking at this, instead of having like a pretzel or something, I would have it.
Yeah. And that's the thing, it's like, I've spent a lot of time in the initial stages of the company just looking for protein snacks. Like a lot of these products were just built for us. Hey, we're building companies, like trying to raise families in some cases, trying to still be fit and healthy and still try to maintain our athletic lives as founders. And so it was like, how do we make a product that helps us do what we want to do? But anyway, so I tested all these different protein chips and protein snacks and protein bars. And I'm with you, like every protein bar you get is just sweet and chocolatey and gooey. And it's just, I want something that's savory. I want something that's salty and crunchy. And I just couldn't find things on the market that really satisfied that crunch or that flavor. So this again is just 66% protein by weight, and the remainder is just fiber. So again, it's like you're getting the 2 healthiest macronutrients basically in our product. And it's really all you're getting. Yeah, it just became a thing where I try to have a bag of it in my house at all times. And honestly, our food scientist, she made me a pesto. And so I added it to some noodles, threw in our forms on top of it, just let it soak in the sauce. And yeah, now I have this high protein pasta meal, and it took me like basically 10 minutes because it took 10 minutes to boil the noodles. So you can eat it dry, you can add it to an array of different dishes. And I really think it's a great product. I know it's my product, so obviously I'm going to pitch it, but I think it's a really wonderful product.
I do too. And little known fact about me is I was a vegetarian for 6 years, and I'm always one documentary away from becoming a vegetarian again. So I don't eat a lot of it. And I was very sluggish, right? And it was totally because, like I said, I don't have a sweet tooth at all, but when I was vegetarian, I craved pixie sticks. Like I immediately craved sugar. And for 6 years, as soon as I stopped being a vegetarian, my sweet tooth went away again. I don't know what that was, but I'm sure it was just, it's not like I stopped eating meat and then started eating very healthy. No, I just ate a different form of garbage, basically.
Yeah.
But yeah, so for me, it's like right on. Plus, alluded to the ecological impact of having plant-based proteins, which is, I think, under-discussed, frankly, particularly what source of protein you get does have an ecological impact too. So I think what you're doing is great. I didn't even know going into this podcast that it was designed to go to Mars. That's really neat, really cool, really interesting. At a whole nother layer. So that's
it's been fun too, because as we've hired more people, brought people on, and some of them don't even realize that this was the kind of origin of the company that came out of this challenge. They're like, oh, we just saw you guys had really cool branding and you sold this cool product that I got to try. But they start getting into the whys and like where we came from. And just randomly, yesterday was the 4-year anniversary of Maia Farms as a company. It's a big milestone for us. It's fun that I get to talk about it on this podcast with you just today. But
happy anniversary. It's so exciting. And I know you're doing quite a bit now, you're doing more in the dental space. So I would urge everybody to watch for Sean, because you have a wealth of knowledge when it comes to overall health and neuroscience, particularly, and leadership. And it's just really great to have you on the podcast. So if people are listening and they want to try out Maia Farms or other places they want to go, where could they find out more?
So with Maia Farms specifically, we're just maiafarms.com. That's MAIA Farms. Yeah, you can find all of our products there. You can find some of our history and just some of the science and dive into things a bit more. I have a presence on LinkedIn, just Sean Lacoursiere. You can find me there. And then I'll have to maybe send out a link to you, but part of working with Alison, I'm going to be one of the guest lecturers on her current course and everything. So I'm going to be giving a talk on what's called ease and intelligence. So how can we use artificial intelligence to help us make our lives easier without becoming brain dead, as you've probably read with all the studies and what it's going to potentially do to us. So hopefully, if maybe I can send a link or something to you on that and we kind of go from there. But yeah, just maiafarms.com. If you want to get to know me more personally, probably LinkedIn is the best. I got more links there, but it's probably where to go.
Yeah. Great. We'll put all 3 links in the show notes. So Sean's LinkedIn, Maia Farms, and then we didn't even mention your amazing sister, Alison Lacoursiere, who's well known in the dental industry. She's been on this podcast and we've done webinars together. She does a great job training, particularly dental teams, and does coaching for dentists too. Sean, thanks so much for being on the podcast. Appreciate it.
Yeah, thanks for having me. This was great. Thanks so much.